Sir, any patient having head spinning is told that he has BPPV. Is this the commonest cause of head spinning?
Yes, BPPV, this is the commonest cause of head spinning, that is true. But everybody having head spinning will not be having BPPV. This disease, BPPV, affects about 20% to 25% of all patients who have head spinning. But there are certain characteristics by which one can diagnose whether it is BPPV or not.
Sir, what does BPPV stand for?
BPPV, it stands for benign, paroxysmal, positional vertigo. It is benign because it is a harmless disorder in most cases and it is not life-threatening and not of any sinister significance. So it is benign, means harmless. Paroxysmal means it can happen all of a sudden, anytime it can happen. So it is called paroxysmal. Positional means it is precipitated only on change of head position. So BPP and then V stands for vertigo. So the full name is benign paroxysmal positional vertigo.
How does one know that he or she is having BPPV?
The symptoms of BPPV are very typical. The patient will have very brief episodes of head spinning that are triggered only on change of head posture. The patient, while getting up from bed in the morning or when lying down in bed or in the supine position, if the patient turns to the left or to the right, or if the patient looks up or looks down, the patient will have a few seconds of head spinning. So this is the hallmark of BPPV, and any patient having this type of a symptom may be having BPPV.
Sir, are there other diseases also which can have a similar presentation?
Yes, of course, there are other diseases also which can mimic BPPV. That means the same type of symptoms. Head spinning for a few seconds only on change of posture. Like some patients of migraine, rather vestibular migraine, also have a similar feature. Then you will be getting some patients where there is a central positional vertigo. That means the symptoms are exactly same, but it is not benign and it is sinister, it is of central origin. So this is not something which the patient can make out. For this, the services of a doctor who is specialized in handling vertigo patients is necessary. They are the right persons who can diagnose whether it is BPPV or not.
Sir, how does the doctor identify that this is BPPV?
There are some clinical tests by which the doctor can identify whether it is BPPV or not. These tests are called positional tests. There are basically three positional tests. One is the Dick-Solpite test, one is the supine lateral test, or rather also called the lateral supine test, and another is the head hanging test. So by these three clinical tests, the doctor can identify within a minute whether it is BPPV or something else.
Are there any medicines to cure BPPV?
No, absolutely no. There is no medicine which can actually cure BPPV. BPPV, after it has been diagnosed by the doctor, is treated by a process called maneuver. There are certain maneuvers like the Epley's maneuver, Simon's maneuver, then barbecue maneuver, Gufoni's maneuver, which are basically physical processes in which the doctor holds the head of the patient and makes certain turns, certain actions, certain movements by which the BPPV is corrected. There is no medicine which can actually cure BPPV or even reduce the symptoms of BPPV. It can only be corrected by these physical processes called maneuvers.
Sir, can you show us what you mean by maneuver? Because the patients need to know what will happen, what will be done, and what is meant by the term maneuver.
Okay, I will try to demonstrate it or I will show it on a video.
Sir, supposing the patient thinks that he or she is having BPPV, how can the patient perform maneuver on himself or herself at home?
It is not that easy. The patient can at best suspect that he or she is having BPPV, but the final diagnosis will have to be made by the doctor, and the maneuvering will have to be done by a doctor who is specially trained in doing these maneuvers. It is usually a neurotologist. A neurotologist is a doctor who is specialized and who has got special training in handling patients who have vertigo and instability and different types of balance disorders. So these doctors are called neurotologists. They are trained in doing the maneuvers perfectly. The patient cannot do it at home himself or herself.
Sir, what is the cause of BPPV?
The mechanism of BPPV is something like this. Inside our ear, we have got two special sensors. One is the sensor for hearing, which is called the cochlea, and the other is the sensor for balance, which is called vestibular labyrinth. In the vestibular labyrinth, we have a portion which is called the otolith organs. There are two otolith organs, the utricle and the saccule. Let us stick to the utricle only to make these things simpler. Inside the utricle, there are some calcium carbonate crystals which are called otoliths. These calcium carbonate crystals are bound together in a sticky jelly-like material. Now what happens is, due to certain reasons, usually as a side effect of some medicine, due to aging or due to some trauma in the head, these particles become loose because the stickiness of the jelly decreases. These particles, when they become loose, they can sometimes get out from the utricle and enter into another part of the balance organ, which is called the semicircular canal. Now these semicircular canals are placed in three different planes, and if it enters the semicircular canal in one plane, then whenever the person will be putting the head in that direction, the particles will move in the semicircular canal, and that will cause tremendous amount of head spinning. These are short-lived. Each head spinning will be just for a few seconds, 7 seconds, 10 seconds, rarely more than half a minute. It's usually lesser than that. The doctor's job is to do the positional tests, find out from which otolith organ the particles have been dislodged and in which semicircular canal of which side the particles have entered. This the doctor can easily make out by looking at the patient's eyes during the positional tests. And then when the doctor knows that this is where the particles have come out from and this is where the particles have gone into, the maneuvers are different head movements by which the trained doctor, the neurotologist, will be able to put the particles back from the semicircular canal into the utricle. And once it is put from the semicircular canal back into the utricle, the patient's BPPV is immediately cured. So BPPV is one of the few diseases where the doctor can offer an instant cure to the patient.
What I understand is that only a neurologist, that is a doctor who is specialized in the management of vertigo, should be doing this maneuver. Do you mean to say that?
Yes, of course. The doctor has to have a deep insight into the mechanism of the BPPV, and the doctor should be trained to recognize the different types of eye movements from which the doctor will be able to deduce this is the place from where the particles have come out and this is the semicircular canal where the particles have entered. And in the semicircular canal also there are different places in which particular position of the semicircular canal the dislodged particles are entrapped. That the doctor can easily make out by looking at the patient's eyes. That is all that is required. And so it is the doctor only who should be able to do it, because he will have to follow the eye movements and understand where the particles have come out from, and then accordingly put the particles back into the original place, and that too is done only by looking at the eye movement.
Sir, we hear of many patients having repeated attacks of BPPV, that is the same symptoms of brief head spinning for a few seconds on changing of head position. It occurs every few months. Can this disease be completely cured by the maneuver?
Yes, BPPV is extremely prone to recurrence and patients are expected to have a recurrence. It cannot be cured permanently by the maneuvers. In fact, it cannot be cured permanently by any other means also except for certain surgeries. By a surgical process, it can be cured permanently, but a surgery is usually avoided and a surgery is done for BPPV only in very refractory cases where say the BPPV is happening 3-4 times a month or the repeated maneuvers are not being able to correct the BPPV. In these cases, surgical management is possible. Usually, not usually, nearly always, it can be corrected by the maneuver, but then it is prone to recurrence. In the initial stages of the disease, the attacks happen once every few years. Then the frequency of the attacks increase and the gap between the attacks decrease. Usually, in a patient, it happens say about twice a year, maximum thrice a year. It usually does not happen every month.
Which types of patients are more prone to develop BPPV?
BPPV is common in aged patients after the age of 65, 70 or so, or still older, say after the age of say 75 or 80, BPPV is quite common. Not that it cannot happen in the younger people also. We do get patients where a teenaged boy or girl has come to us with typical BPPV and correcting the BPPV by the designated maneuver gives the patient complete relief. But as I said, it is more common in the geriatric population.
How does the patient know that the BPPV has been corrected?
Well, this is very easy. The symptoms will disappear immediately. Then the patient will know that yes, my positional vertigo has been corrected. The patient will be able to lie down, get up, turn towards the side in which it was happening, look up, look down, and there will be no positional vertigo. And there will be no head spinning. So then the patient will know, yes, the doctor has done an excellent job, and the patient should thank the doctor immediately for giving the patient immediate relief.
Sir, you have said that the medicines have got absolutely no role in BPPV. But we find that in many patients, the diagnosis is written as BPPV, but the treating doctor has not done any maneuver and prescribed some anti-vertigo drugs or vestibular sedatives. But some of these patients also get better. Now, how does that happen?
What I did not mention or what I had forgotten to mention is that BPPV is a self-limiting disease. That means even if the maneuver is not done, over a period of few days or maybe sometimes a few weeks, the positional vertigo usually gets corrected by itself, because these particles, when they are falling into the semicircular canal, after a finite period of time, these particles start disintegrating and they get dissolved. And so the symptom of positional vertigo gets corrected by itself spontaneously after a finite period of time. So that is why some patients get corrected even without doing the maneuver. Now coming to the question of medicines, yes, I am also aware that many patients are prescribed these anti-vertigo drugs. They have got absolutely no role. I am reiterating this once again, that medicines have got absolutely no roles in the management of BPPV, and drugs like beta-histine, cinnarizine, dimenhydrinate, prochlorperazine, then meclizine, all these different types of anti-vertigo drugs that are usually prescribed should never ever be prescribed for BPPV. They have got no role whatsoever.
What precautions are necessary so that it does not recur?
There is no specially known precaution which the patient will have to take or can take that will prevent the BPPV from recurring. It has been statistically shown that patients who have got low levels of vitamin D, low levels of calcium are prone to develop BPPV. So, it is prudent that when a patient is having recurrence of BPPV, the doctor should evaluate the vitamin D and calcium levels, and if it is found to be deficient, then supplement vitamin D and calcium. But other than that, there is absolutely no role. I am stressing this thing over and over again. There is no role of any medical treatment in BPPV.
This video has been made to create public awareness and to educate patients on some basic medical issues related to balance disorders. Information provided is on the basis of personal experiences and knowledge of Dr. Anirban Biswas, gathered over 40 years of medical practice. Viewers are hereby instructed to verify and authenticate the information provided by the patients, consulting detailed medical texts, and by discussions with their personal physicians. In all the matters, the opinion of the physician treating the patient is final, and the patients are to follow that advice only, be it treatment or diagnostic tests. There is no intention to hurt or modify the business prospects of any organization, be it a pharmaceutical company or a medical institution or a medical instrument manufacturer. The purpose of this endeavor is to promote ethical and scientific medical practice and to allow patients make an informed decision congenial to their best interests.